Okay, today we're going to talk about something that actually a problem that I've been receiving a lot of questions about in my Facebook page, Pillow Talk with Doc Mitch Tado. And I think it's also very important that we talk about this topic again and again because actually, shoving this aside or not really giving much importance to it may actually lead to problems, to a lot of problems eventually in the future. So, this is actually polycystic ovarian syndrome or Pcos. Okay, Pcos is usually a problem caused by hormonal imbalance. Majority of the time, or most of the time, or if not all of the time, okay, women who have Pcos actually have an elevated male hormone. Now, you tell me, Doc, male hormone, if female tayo, di ba? Bakit may male hormone? Okay? Now, all of us actually, women, have a small amount of male hormones in our bodies or androgens, yung tawag natin na androgens. Okay? From 15 to 70 nanograms usually ang level of androgens in our body. However, there are some women who have a slightly elevated level in their bodies, causing all the irregularities in their menses, okay, difficulty in getting pregnant. Also, women with Pcos may actually experience frequent bouts of acne. Nagkukook yung sister ko, naririnig niyo yung pag-mix niya. But anyway, okay, so frequent bouts of acne. Women also may experience some form of baldness. And what's really bad is that women who have Pcos may actually be more prone to developing chronic illnesses in the future like heart disease, diabetes, and stroke. Now, polycystic ovarian syndrome actually affects the level of hormones in women in the reproductive age. 2 to 27% of women in the reproductive age are actually affected by this disease entity. Now, Pcos affects the ovaries, which actually produce your estrogen and progesterone in a small amount of androgen or the male hormone. Now, so every month, the ovary actually produces egg or a mature egg that can be fertilized, okay, and become a baby. Okay, so this monthly production of egg is called ovulation. Now, ovulation is actually also governed by two other hormones, namely the follicle-stimulating hormone and the luteinizing hormone. Now, the follicle-stimulating hormone triggers actually or signals the ovaries to produce egg cells. And the luteinizing hormone, in turn, now triggers the ovaries to release a mature egg that has the potential to become a baby. Now, in polycystic ovarian syndrome, what happens is actually this whole process actually is affected. So, Pcos is actually a syndrome or a group of symptoms that actually affect the ovary and ovulation. Okay, so it's characterized by three things. Number one is multiple cysts seen in the ovaries inside, okay, through ultrasound. Number two is an elevated level of androgen. And number three is irregular cycles. And ovaries of women with Pcos actually have growths of multiple small cystic structures. And so this is actually why it was called a polycystic syndrome or polycystic disease, because of how the ovary looks like in the ultrasound. So it has multiple small cysts that actually don't mature. And these are cysts that have the potential actually to become dominant follicles, or the cysts that are mature that can become a baby. However, with polycystic ovarian syndrome, this does not happen. The eggs inside the cysts, actually the cystic sacs actually don't mature, and so because of this, ovulation does not happen. Now, when ovulation does not happen, there's a decrease in the production of your estrogen, or a decrease in the level of your estrogen, your progesterone, your follicle stimulating hormone, and your luteinizing hormone. Alright, so there's also an increase in your androgen or your male hormone. Now, the slight increase in your male hormone now actually also affects your menstrual cycle, causing irregular and infrequent periods. Alright, so what causes polycystic ovarian syndrome? Now, unfortunately, up to this point in time, a lot of studies still show that they cannot really actually identify the real cause of polycystic ovarian syndrome. However, there are multiple studies being done now that have that have identified three things that may actually put a woman at a higher risk of developing this illness, namely genes, number two, insulin resistance, and number three, inflammation. Okay, some studies actually show that being Pcos can be genetic in nature, meaning namamana siya. So it can be actually passed on, or it can be present in, if, like say for example, in families, like say for example, if you have a sister, or you have your mom had polycystic ovarian syndrome, then you may actually have also polycystic ovarian syndrome. Okay, second, inflammation. Now, studies have shown that inflammation is linked to higher levels of androgen. Okay, so obesity can actually cause inflammation. So this is actually linked to polycystic ovarian syndrome also. And lastly, insulin resistance. Now, insulin resistance actually happens when the body is not able to use insulin properly. Now, what is insulin? Insulin is actually a hormone that is produced by your pancreas in response to you being able to actually, or the body being able to use the sugars from the food properly to become actually energy, okay, for the body functions. Okay, however, if you cannot use insulin properly, then what happens is the body demands for more insulins. Okay, so it now triggers now a cascade of events. So when there's an increased demand in your insulin, your pancreas now will produce more insulin. And unfortunately, more insulin will mean that it actually triggers your ovaries to produce more androgens. All right, now let's talk about the common symptoms of PCOS. Okay, now some women actually notice that, or they know that they find out that they have PCOS during their first menstruation. Okay, and some actually find out after they've gained a lot of weight, or they've had difficulty in getting pregnant. But the earlier, actually, what I just need you to remember is the earlier that you note that you have polycystic ovarian syndrome, the earlier that you have to see your doctor and get treatment, because the earlier you get it, the more actually you are at risk for developing chronic diseases like diabetes, hypertension, and stroke. Okay, so what are the common symptoms that women actually with PCOS have? Okay. All right, so the following are the 8 most common PCOS symptoms. Number 1 is irregular cycles. Now, because ovulation does not happen monthly, and women with PCOS don't shed every month. So most women with polycystic ovarian syndrome have fewer than 8 periods every year. Okay, number 2 is heavy periods. Okay, so number 2 is heavy periods because your endometrium takes a longer time to build up. So it takes a longer time to thicken. By the time that you menstruate, okay, so kunyari, you've skipped 2 to 3 months. So by the time that you menstruate, you now have actually heavier menses. Okay? Alright, so number 3 is abnormal hair growth. Okay, women with PCOS may actually notice that they have hair in areas that they're not supposed to have hair in. Okay, like male pattern hair growth, like hair in the face, okay, in the chest, or in the abdomen, or even at the back. Okay, this type of hair growth is called hirsutism. It's actually different from being balbon, or what we call hypertrichosis. Alright? Okay, so 4th most common symptom is acne. Now, women with PCOS usually have male type of skin. So, it's oilier, the pores are bigger, so you're more prone to breakouts. And most of the time, the pimples actually are seen beneath the cheekbone, in the jawline, and around the mouth. Okay, so these are hormonal pimple patterns. Okay, so 5th most common symptom is weight gain. Now, women, 70% of women with PCOS are actually either overweight or obese. Okay, 6th syndrome is male pattern baldness. Okay, so there's a thinning of the hair in the scalp, and you actually can have hair loss. Right? And then 7th most common symptom is darkening of the skin. Now, there are dark patches of skin that can actually occur when in women with polycystic ovarian syndrome, like increases like under the neck or in the neck area, under the breast, okay, or in the groin. And then eighth most common symptom is actually headache. There are some now, an increase in your androgen can actually trigger frequent bouts of headache. Now, why should you worry about it? How does Pcos affect your body? Now, a higher level of androgen in a woman may actually affect, first and foremost, your fertility, and it can actually trigger the development of other chronic diseases that you wouldn't actually want to have, okay? So, as I've said, number one is infertility. So, polycystic may actually cause infertility. Now, to get pregnant, you have to ovulate. Now, women who don't ovulate as frequently as the normal woman without Pcos actually will have a more difficult time in getting pregnant. Alright, the next is metabolic syndrome. Now, 80% of women who have Pcos are actually either overweight or obese. Now, obesity and Pcos actually increases your chances of having high blood pressure, high blood sugar, high LDL or bad cholesterol, and low HDL or good cholesterol. And these things put together is called the metabolic syndrome. And the metabolic syndrome will actually make you more prone to developing diabetes, chronic hypertension, and stroke. Okay, next. So, obese women with polycystic ovarian syndrome are 5 to 10% at a higher risk of developing sleep apnea. And what is sleep apnea? This is actually a condition of when you have periodic interruptions of breathing when you sleep, and so this actually disrupts the whole cycle of sleep kasi you totally stop breathing. So women who are obese and who have polycystic ovarian syndrome are at a higher risk for this. Okay, next is endometrial cancer. Now, because there is actually an irregular sloughing off of the lining of your uterus, then actually what happens is the lining gets built up, and this actually the endometrial thickening may actually lead to a lot of problems, and one of those is endometrial cancer. And then finally, polycystic ovarian syndrome and the symptoms that actually that come with it actually may cause depression and anxiety, and a lot of women in the younger actually age group, they get depressed with the acne breakouts or with the irregular cycles, and hormonal imbalance per se can actually cause some disturbances in the mental status of patients. Okay, so how do we diagnose it now? Doctors actually diagnose Pcos in women when they have two of the three symptoms that I actually already mentioned earlier, namely increase in your androgen, multiple cysts in the ovaries, and irregular cycles. Having at least of the three symptoms will actually now tell us that you may actually have polycystic ovarian syndrome. Now, how do we check the level of androgens? We actually ask for a blood test. How do we know if there are multiple cysts in the ovaries? You now actually have to undergo ultrasound, whether it be transvaginal or transrectal. Okay, and then third, irregular cycles can actually, we actually get this through history taking. Most of you actually come to our clinic because of this, diba? Okay, so Pcos and pregnancy. Now, polycystic ovarian syndrome actually disrupts the whole normal cycle of ovulation, menstruation, ovulation, and then menstruation again and ovulation again. So, when you don't ovulate, it actually is harder now to get pregnant. So women actually with Pcos may have a harder time getting pregnant, although there are already medicines that we can give for women who are desirous of pregnancy but who have Pcos, okay, who have polycystic ovarian syndrome. And usually the initial treatment is we give you clomiphene citrate. However, if you are a non-responder, then we can actually put you in several other regimen programs that will help you get pregnant. Now, however, having also polycystic ovarian syndrome can make you more prone to pregnancy complications like premature delivery, miscarriage, development of hypertension, and gestational diabetes. All right, so now let's now go to treatment. Okay, the treatment is actually divided into two parts: the non-medical and the medical. The non-medical is the lifestyle change, which is now comprised of weight loss, diet, and exercise. Okay, so if you lose 5 to 10% of your present weight, this can actually, help re-regulate all the hormonal imbalances, and it can actually decrease your chances of getting diabetes. It can lower your blood sugar, it can lower your cholesterol, and it can lower your risk for developing chronic illnesses. Now, any diet that actually helps you lose weight will actually be okay. So you have to experiment on what works best for you. But it would be good not to go on crash diet regimens, okay, that make you go, yo-yo. Okay, so your weight loss actually fluctuates. So it's better to stick to a diet that is slow and progressive, wherein you lose at least 1 to 2 pounds a week. That's a very healthy type of weight loss. Okay, exercise, we actually recommend a light to moderate intensity exercise of about 30 minutes to an hour a day, 3 times a week. Okay, do not engage in high intensity exercises because this may actually trigger further the increase in your androgens, so it's not actually recommended for polycystic ovarian syndrome patients who are trying to lose weight. So remember, low to moderate impact only. Now let's go to the medical treatment. Now the medical treatment will really depend on what your goal is, whether you want to get pregnant or you don't want to get pregnant. If you want to get pregnant, then we can actually give you what I've already mentioned previously, clomiphene citrate. This will actually help you ovulate and help you produce a mature egg cell that can actually be fertilized. Okay, so but if you don't want to get pregnant, we usually put our patients on birth control pills that will help basically reprogram the ovaries in producing the right amount of hormone at the right time, and this will actually help decrease the androgen level in your body. We also give you metformin, and this will actually now target improving your insulin sensitivity. And then finally, we can actually also suggest other ancillary procedures like hair removals for unwanted hair, and some patients previously in the past would undergo surgeries to help them in their fertility. But the bottom line is, what we really just want to stress is, if you've experienced, irregular cycles in the past, or you've missed your period and you're not pregnant, or you're trying to get pregnant and it's been like a year already and you haven't been really successful yet, then maybe it's best to now set an appointment with your OBGYN to find out further what is actually going on inside. Now, as I've said, polycystic ovarian syndrome is not just like a simple irregular cycle type of problem, but it can actually lead to chronic diseases like hypertension, diabetes, and strokes, and even cancer. So it would be best that you get yourself treated, get yourself monitored, and try to control this disease or the symptoms of this disease, because unfortunately, once you're polycystic, you're forever polycystic. So we just need to manage the symptoms in order for us to decrease the possible complications. So with that, I hope you found this video very informative, and if you did, please don't forget to give us some love, and then you can actually write your comments down in the comment section below. And thanks for watching. God bless you all, and stay safe, everyone. Bye-bye.